Good afternoon. On September 7th, when you announced that health workers would have to be vaccinated, there were fewer people in the hospitals and in intensive care. So how can you justify today backing down on the requirement when the situation in hospitals is actually worse?
Well, Horacio can answer a lot better than I do on this, but I'll say one thing. We made those decisions on forecast because back then, at the end of August, at the beginning of September, we knew we were entering a fourth wave. And I'll let Horacio.
Actually, it's true. We know we're going to have some cases. We know we're going to have some people in hospitals and intensive care because there is non-vaccinated people and there is some vaccinated who will go there. But the level is not what we thought we would have based on projections. We get a better number of cases. It's going up a little bit, but it's normal because of the people getting inside. We are, and we follow that every day. We get good coverage rates, actually, compared to in August, really better. Even we came from 93 to 97 in healthcare workers. We now think that the balance between trying to fight again the ones who don't want to be vaccinated and putting them at home will create, I would say, loss of empowerment of resources for healthcare, and we can make sure they're going to be protected, the people are going to be protected if we do testing, but real testing. I'm telling you, people will not accept to be tested 3 times a way and not vaccinated. They would have to go home. That's absolutely not acceptable for us. So we think with that, we are in a good situation, and we will follow again and again, and even with the different things we announced yesterday for November, my minister told, let's go this way progressively for not making our system in a problem.
But in October on Tout le monde en parle, Mr. Dubé, you said it was non-negotiable that there would be someone working in an ER or an operating room who was not vaccinated. What do you tell to patients and Quebecers who are vaccinated and now they will be at risk in certain hospital environments when they go in for care? What do you have to say to those people?
Yeah, but that's the reason when we look at those different scenarios, the number of people that are in that situation in ER are very limited. So the first thing, as we discussed, and that was one of the questions before, are you able to replace those persons by vaccinated person? The first thing will be done when it can be done. So that's the first thing that local managers will do. That's the first thing. The second thing is that when that draw an implication of the domino effect that we were talking about, well, we'll say let's make sure at least that those people are tested 3 times a week. And that's the reason I'm saying I'm putting a lot of energy now. This is behind us because that was a decision that we had to take to make those schedules for the next few weeks. Now that we have that, my next step is making sure that we get as many nurses back in the place. So at one point, the local manager can say, well, I don't need those people anymore, and I can have vaccinated in those services if we have not been able to replace them before. It's very clear this is our priority, is to get additional nurses coming in.